Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Amelia L. She's an osteopathic physician. Today's Kevin MD article is From Skin to Soul, What Pain Reveals About Our Health. Amelia, welcome back to the show.
Thanks so much for having me. Great to see you again.
All right, so tell us what your latest article is about.
This one struck me from both a personal and a professional standpoint, and I've been really exploring pain on lots of different levels. We talked most recently kind of about this pain epidemic and pain medication use, and this one really was about how pain presents itself in the ways we can listen in creative ways the body tries to get our attention. And I shared near the end of the article two experiences, one very personal to me as a second year med student. I had this crazy case of eczema where, everybody came into the room to see what was happening and it was non-responsive to all the usual treatments. And then once the first round of boards was over, it largely dissipated. I thought, oh, I was probably experiencing a whole lot more emotional strain and pain than I realized. And my skin was the way that it was alerting me. And that really tuned me into different experiences with my children, with my patients, and just offering that up to the audience here of how we might listen, both as clinicians and within ourselves, to what the messages at that superficial layer might be offering about a much deeper issue.
They always say that the skin is the largest organ. And why is it such an effective messenger for whichever health issue, both internal and external?
Mm-hmm. Well, we can see it, right? So I think that's the key part because a lot of times we need to be alerted in a very key and core way. So it might be through a rash, it might be through pain because it's the largest organ. It's also the largest site of nociceptors. So it really is where pain is highest concentration. When I was on an inpatient service for osteopathic manipulation, we would treat patients postoperatively and there'd be an incision. And a lot of times the biggest area of aggravation in their nervous system was from the incision, right? Because the skin had literally, right, been aggravated by the scalpel. And so going to the correlating area in the spine to calm down the sympathetic nervous system was one of the most important pieces. And we would talk to them like, this is really where the pain is generated. Yes, the more major part of the surgery happened on a deeper level, but the skin really holds such a high concentration of that pain information. It's what can clue us into how we're doing. And so I think the messenger really is the visibility, and it has the greatest chance of getting our attention through those pain receptors.
Now, through your practice, have you encountered other cases where a skin condition could be a manifestation of something psychological, similar to the story that you shared yourself?
Absolutely. And there's two. One that I shared in there that was more of a physiological concern. A patient came to me with rib pain, which is pretty typical for a neuromusculoskeletal medicine specialist, and highly expected that I would, put my hands on and treat the rib and it would be better. But as the story came out, as I was listening to what was accompanying this rib pain, it was almost a classic, board case of pancreatic cancer, unfortunately. At least it was able to be treated for this patient, but her rib did hurt. That was true, right? And so that's the other important thing is the pain is real, but the message is coming from somewhere else. And our pancreas, right, can't tell us much from the inside. So it's finding its way through different pathways to the surface level to express that. And absolutely different rashes and skin manifestations coming through from that perspective of stress, of anxiety, of depression, and really drawing attention in that way. And so one of the classic ways that we see that is through hives. Let's say you're about to give a presentation and your body just reacts with this big red rash, or you get sweaty, you get inflamed, and it's alerting you to a sense of lack of safety on the inside. And in that setting, you could reassure yourself, right? Nothing untoward is going to happen. Maybe some embarrassment, maybe some heckling at the worst. But that's also our body's natural physiological response to something that feels threatening. It alerts us on a superficial level, again, because we can see it or those around us can see it and say to us, hey, like you look different. Is something else going on? And we can begin to explore. And that's my hope in sharing this article is that as physicians, we can take some of those manifestations and ask a little bit more about that. I'm a member of Physician Moms Group, one of the largest, medical groups for physicians on Facebook. And derm is always the highest query, right? And some of it is very classic. It just is this. But if we can sometimes turn that knob a little bit and say, well, what else might be here, right? The derm psych connection is really powerful, and being able to alert ourselves to that, and also a degree of wellness, right? So the state of our skin can also tell us just globally how our body is doing. And that can be both physical health, but also mental health as well.
So I'm a primary care physician, and for those other primary care physicians who may be listening to you, someone comes in with a rash or a skin condition, some type of superficial pain. What are some other questions that we could ask them to potentially uncover something underlying?
Absolutely. And I think it's important to start with some of the basics. For me, for example, for the eczema, it also was wheat driven. I learned later in my life that I had a gluten sensitivity that I didn't realize. So some of those more basic things, what has changed in your life, that exposures, that could be food, that could be, chemicals, lotions, whatnot. But then also, what else has changed, right? Did you move? Has there been a change in your relationships? How's your sleep? And if we're seeing that rashes or, joint pains that are presenting, that's a really superficial level thing as well, or muscle tightness even, asking a little bit more about what's happening in their life. And we know we have a lot to unpack and manage in short intervals of time. But also, if we can get to the core of what's happening, we might save ourselves multiple visits, right? Or spinning the wheels or having to apply medications that really aren't effective because that's not the core of what's happening. So finding out what's changed in your life. And we think about, when did this rash happen, or when did this pain in this area of your body, this tightness in these muscles begin? And is there any corollary of some event that happened as well, in stress being key and core? And we know stress is at an all-time high right now. We're seeing a lot of tumult in the country. 2025 has all kinds of interesting energy. And so holding a little bit of space to say what else might be contributing. And it might not just be one thing, but it might be what is exacerbating this. And can we mitigate some of that so you're not totally inundated? Because when you have a rash or pain at a muscle level, it is highly distracting, right? People
Yeah.
become less productive. They're irritable with their families. It can be really detrimental to their health on a broad scale. So offering that space to inquire is really powerful.
You alluded to that story that you talked about in the article about a patient's skin condition that ultimately led, unfortunately, to pancreatic cancer.
Mm-hmm.
Tell us the steps in between that led to that connection.
Yeah, absolutely. So this, and I related a little bit. I went from working in a very large healthcare system in Michigan. I moved to Oregon. It was a solo private practice, and it was kind of a flip for me. And the large healthcare system, I was always the last physician anyone saw. They'd had all the studies, the surgeries.
Yeah.
And so I was rarely the initial workup for anything, which was okay. That worked in my consultancy. Where I moved in Southern Oregon, I was often the first physician because people were somewhat skeptical of the traditional medical system. And I was kind of on that fringe. Okay, you're a doctor, but you
Yeah.
seem to have an alternative approach. And so I was getting all of these cases, and this was one that just struck me, where this person presented with rib pain and had been seeing a number of different alternative providers and having different treatments applied, and expected to come to me and have a hands-on treatment for this rib pain and to have that alleviate it. But her story was almost, like I said, just textbook for what pancreatic cancer would present as. And for her, the rib pain was real. And it's important to validate that. Yes, this is true. And I can palpate here and I can see it feels different, right? I can
Yeah.
understand that. I could treat it, but I'm not going to solve the issue. And it's going to keep coming back. And also, thank goodness you're being alerted to this pain, because it's telling you now that something else is happening deeper in your body. Because again, oftentimes we don't know, because the pancreas doesn't have a whole lot to say, doesn't have a whole lot of pain that's going to come until it's, has a mass that's so engorged and they're stretching the capsule that it would be known to us. And so this is actually a great messaging system. And from there, we were able to initiate appropriate workup and evaluation and treatment. And actually, the patient did well, survived, right? Which is sometimes not the case for pancreatic cancer. And so
Hmm.
that alert at the superficial level, maybe sooner than had we waited for the organ to really demonstrate dysfunction, was actually quite helpful for her.
Now, you're an osteopathic physician. Are there specific
Mhm.
things about osteopathic education that makes you more attuned to dermatological and musculoskeletal manifestations of underlying disease?
Absolutely. One of the first things we learn in medical school is parts. We're looking for tissue texture changes. So that's really what we're doing. We get to the skin level and we just drag our hands down and say, is it warm? Is it boggy? Is there a ropey texture here? So we're saying, what is this telling us about something deeper in the body? And it could be telling us about the vertebral structure, but usually it's from the nervous system alerting us, right, to the different organs and to the different ways the patient is kind of balancing out their nervous system. And so, yes, from the very beginning, we're like, what at the surface level is it telling us deeper within the patient? And then on a broader scale, what too are we learning about body, mind, spirit connection, right? How is this all being impacted? So I think it's very much part of the osteopathic approach. And for me, the osteopathic approach is for everyone, right? For physicians of all sorts and degrees, but for everybody to learn, how do we listen to what our body's telling us and what is being connected mentally and spiritually, emotionally as well.
So, as you know, there is an epidemic of chronic
Mm-hmm.
pain. That's one of the more common reasons why people
Mm-hmm.
come to me to see primary care. Comments about the missed opportunities that we have in terms of just looking at the pain itself, and
Mm-hmm.
maybe looking kind of beyond that to see what kind of underlying conditions that pain may be masking.
Absolutely. And it's interesting. I'm in this new space and phase of like creating the pain detective, because that's what it feels like a lot of times. It's
Yeah.
just kind of getting deeper into the layers. even recognizing what pain is, because some of the things we've described, you might not identify. Like I had nodular eczema, it's a rash. It was irritating and painful, but that's also a manifestation, right? It's strain in the system. And so acknowledging what pain even is for us. And then what is it telling us and how do we process it? Because for me, I didn't realize, I never identified as a person who's stressed out taking tests, but clearly
Yeah.
on some subconscious level, it really was a big deal. And maybe I felt ill prepared. I'd never taken a board exam before. And so being able to tune into something's going on, my body's alerting me to this. What else might be bothering me? And if I panned out a little bit more, we looked at food and we looked at exposures, we didn't necessarily say what else is going on in your life. And at that point, boards were so prevalent, you almost don't notice that it's happening.
Yeah, yeah.
But it was a new experience. And so being able to tune into this does impact me, right? These external circumstances do have an influence on my health. And I couldn't undo the fact that I had to take boards, but perhaps being able to say, hey, I am stressed out about this, right? And it's okay and that's normal. And to hold space for that, it's not always about jumping to feeling better, but sometimes understanding why can be alleviating. I wouldn't necessarily have undone the dysfunction in that moment. The end of having taken boards was actually where the rash began to resolve. But knowing, oh, well, this makes sense because I'm in a stressful experience and this is how my body is manifesting it, because it was so distressing to go to appointment after appointment and try all these different treatments and have no answer.
Yeah.
So sometimes having the answer, even if it doesn't resolve the condition right away, can provide a lot of internal relief. And I think that's one of the key pieces we have the opportunity to offer to our patients.
We're talking to Amelia Beakey. She's an osteopathic physician, and her Kevin MD article is From Skin to Soul, What Pain Reveals About Our Health. Amelia, let's end with some take-home messages that you want to leave with the Kevin MD audience.
I think just gratitude for what the power of the skin has to offer us, and doing some gentle and general inspections. If you encounter something in your body that's unusual and abnormal, yes, asking those questions about what has changed in my life, but take that word exposure to a broader scale. What are the different stress exposures? What environmentally is happening? What emotionally is happening for me here? And then offer that up in the clinical space to be a little more curious as physicians, to say, if I'm seeing this and it's puzzling to me, or maybe it seems like a classic rash, I'm going to ask some deeper questions to give my patient the best chance to have a comprehensive recovery from their challenges.
Amelia, thank you so much for sharing your perspective and insight, and thanks again for coming back on the show.
Thanks so much.